All right. Well, thank you everyone for tuning in to join us. I'm Kirsten Lange, president of our NAACP Santa Rosa Sonoma County branch, and I am joined here by these dynamic, amazing women in our Sonoma County Health Department and health team who've worked tirelessly to continue to understand the data and unpack the information that we have before us. We know from the Portrait of Sonoma that the data presented paints a lot of different stories. And until we can continue to have the conversation about the background and more folks continue to provide insights, that we can really work together towards some solutions. So I'm going to turn it over to Tina Rivera to kick us off and get started.
Thank you, Kirsten. Well, good evening, everyone. It's really a pleasure to be here with you tonight. And joining me tonight is Dr. Kismet Baldwin. Again, before I introduce Dr. Kismet Baldwin, I'm Tina Rivera, the Director for the Department of Health Services. And we have Dr. Kismet Baldwin, who is our Deputy Public Health Officer with our department, and then Denya Candela, who is our Department Equity Manager. And we're here tonight to share with you about the health and well-being of Black residents here in Sonoma County. We have a lot of information to share with you, and just to frame what we'll be talking about tonight, we want to discuss and kind of walk through and understand how the social determinants of health, and what we mean by that is the economic stability, economic access to health care, neighborhoods, as well as social and community context, how this impacts the health of our community. And then we also want to share some data that we have on our Black and African American health here in California, in Sonoma County, and we'll also be sharing some national data. We want to understand and discuss the limitations around that data, because there are quite a few limitations around the data here in Sonoma County in particular. And then we want to discuss further the data of the Black community and what you think is important in assessing the health and well-being of the community. And then talk about what possible next steps could be. And so with that, I'm going to have Denya kick off our presentation. And she's going to share some slides, and we'll begin.
Sure thing. Thank you, Tina. I'm going to share my screen, and please give me a thumbs up when you see it pop in on your end of things. Can you see that well? Perfect. Awesome. And you're able to see the presentation, right? Not the notes and comments?
It's not in presentation mode.
It's not in
No, but we can't see the notes and comments.
Oh, let me just take this off. There it is. Let me, is that better?
Yeah.
Perfect. Thank you. All right. So we'll get started. Thank you, Tina, for that wonderful introduction. And thank you for hosting us tonight as we walk through some of that. This is kind of what Tina covered today, and just kind of laying out the landscape of what we'll be kind of talking about and walking through tonight. As mentioned, we wanted to actually ground ourselves and talk about some of the data limitations and considerations. As mentioned previously, we want to acknowledge that the information that is being presented in the slides is from different areas, right? National, state, and local data sources. So you'll see that throughout the presentation, and it's different comparisons between them all. We also want to acknowledge that we need to find better ways to understand and communicate Black residents' experiences in Sonoma County in order to really inform the action that is needed to do this work. We recognize the need also to be really intentional in the ways in which we analyze and present data for community that is typically centered in Western teachings and academics. So that's something that we're on our journey on and trying to understand better as a department. And we want to make sure that we were grounded on this as you guys kind of walk through this data here with us today. And right in that same spirit, we really want to actually take a moment to breathe and just really be here present and kind of center ourselves and ground ourselves in the fact that behind these numbers are people's lives, experiences, stories, and narratives. We are made up of all these beautiful people here in Sonoma County, and we want to acknowledge that with such data come emotions and feelings and stories that some of us have experienced and continue to experience, and very much want to make sure that we are grounded in the importance of elevating the human experience throughout kind of this whole process, and the people that are behind every number that we talk about and every data point that we talk about, whether it's here in Sonoma County or nationwide or statewide. So I'll here, I'm kicking us off, and I get the pleasure to really framing the conversation around the social determinants of health, and really this wonderful kind of visual that we have in front of us is from the Bay Area Regional Health Inequities Initiative, otherwise known as BARHI. And really they have this visual represents what we call the different aspects of the social determinants of health. And really, in essence, it explains to us how social inequities, institutional inequities, living conditions as to where you play, where you work, where you eat, where you live really are connected and interconnected to one another in driving people's health outcomes. We know that based on research, the medical care and access to really care only accounts for 10 to 20% of a person's health outcomes in general. And the conditions, and as I mentioned, where we're born, where we have lived, our histories, and where we play, and what age we are, really are wider forces in creating those really critical indicators of health, and really contribute to the ways the systems and conditions our daily life. And that really accounts for 80 to 90%. So when we really look at the whole picture of what makes up somebody's life and living a healthy and thriving life, it is a lot more complex than identifying access to healthcare, for example. So with that, really, it's something that we are starting to see and understand that how in this particular way, policy, strategic partnerships, and really all is interconnected to really driving better outcomes for all Black, Indigenous people of color in Sonoma County, but also like conversations that are happening nationwide. And we can see the current public health practice of what I would like to say what used to be, because these conversations have happened a lot more often now, and what the emergent public health practice is beginning to see and really morphed into. So with that, this other wonderful framework from Rodishka, I'm pronouncing probably in a bribe, Rodishka Yerbai is an awesome Black woman researcher who actually presents to us the social determinants of health, or what we describe as the social determinants of health in some of our fields, and understanding, like we mentioned, where we play, where we receive our healthcare, it's totally interconnected to other pieces of greater systems that in our case, maybe perhaps don't land within our department, for example, as an institution, right? That's just this example to our piece of the pie, if that makes sense. And in here, we list this, we see the systems being listed out: public health, neighborhood and built environments, education, and economic stability, all are drivers of health and well-being. And when we apply tools such as political processes, budgetary decisions, investment and regulation, and actual enforcement of those policies, we start to think about what tools begin to address the very same systems that contribute to and are connected to the social determinants of health. Underneath all of that, as we have done research and we have understood more, there lies this structural racism, right? And sexism, ableism, a lot of the isms that are underneath all that. So when we are able to kind of disconnect those two and really get to the root cause, we are able to see and understand better how each other play a role. That's why it's really important that the conversations that we have are centered in that beautiful intersectionality that makes us more than a data point, like we talked about earlier, right? Like, and we understand the whole person care approach and the understanding of what makes us us. I'm gonna pass it over to Dr. Baldwin now. And kind of let her drive our next kind of set of slides, and she really gets to drill down on some of the data here tonight.
Thanks, Denia. Just like Denia and Tina already mentioned, I'm going to go through some of the data. It's going to be data on some of those social determinants of health, some of the, downstream outcomes that we're seeing because of what's happening with the social determinants of health. And then they're going to be at a little bit of a mix of county level, state level, national level, to get a flavor of what's happening in the Black and African American populations. So, okay, next slide. So our first one is access to education, and this is, surprising. This is Sonoma County level. Black adults have a lower educational attainment rate than the county average in Sonoma County. And 69.3% of Black children and young adults, and that covers anywhere from 3, so maybe daycare all the way through 24, college, are enrolled in school. But that's much lower compared to 77% of Latinx youth and 80% of white youth and almost 88% of Asian youth. And they're, Black and children and youth are, the educational, enrollment is lower in Sonoma County, compared to other races and ethnicities, but also lower than the state percentages for Black children and youth across California. So, when we're looking at races and ethnicities in Sonoma, it's lower, but even comparing to other Black, children and youth in California, it's lower in Sonoma County. Next slide. Earnings and standard of living. Again, everything kind of plays off of each other. If you're, if your educational attainment may be lower, that can impact your, earnings and standard of living. And the median personal earnings for Black residents in Sonoma County are about, $5,600 less than white residents in Sonoma. And 2 out of every 3 Asian and white households in Sonoma County own their own homes. That's double the rate of Black households in Sonoma County. And despite, the fact that Black residents represent only, approximately 1.5% of the county population, yet they account for 6% of the unhoused in a recent homeless census count. I think that was coming from 2020. So again, just kind of shows how all of these, start to interact and intertwine and play on each other. Next slide. I think Jenya's previous slide was, I think, a really good look at some of those root causes and social determinants of health. This is just another way to look at it, kind of looking at the pie, what's all going into a person and a population and a community's health and well-being. And just as she said, access to healthcare is not the only piece, and it's oftentimes not the biggest piece to that pie. There's a lot of other things that are happening that contribute to how a person is doing and a community and population is doing. And even though it says COVID-19, this is for everything. It could really be applied to any outcome, any illness, anything happening. So I think this is another good look at what's contributing. So okay, let's look at a little more data and some more social determinant of health information as well. So there's a lot going on the slide, but the big thing is if we're going to take a look at healthcare access, and again, this is at the national level. And I think, the top right a graph is this looking at disparities in health coverage for Black people compared to the white population in the US. And in 2010, the gap was much wider than it is now, and that's an improvement. That's good. It may have a large component is due to the fact that the Affordable Care Act was passed, which was great. But there's still a gap, and there shouldn't be a gap, and everybody should have equal access to health insurance and in the healthcare system. So there's definitely still work to do. And going down to the lower left-hand slide, Black people have higher rates of illness and death compared to white people. Probably, access to care plays into that as well, and some of the other things that are in that social determinants of health. I think the most striking one, though, is if you're looking at on the right-hand side, infant mortality. So infant deaths, it's still in the lower left presentation, but it's the farthest right on that. Infant mortality per 100,000 live births in 2018, it's a huge difference between white and Black infant deaths. And that has held true in California as well. Because the numbers are, small in Sonoma County, the overall number of births to Black, African-American mothers, it's a little difficult to know exactly what's going on, but this is a major issue. And I think there's a lot of interest and desire to try to figure out what's going on and how to close that gap. And then the final one here on the lower right-hand corner, it's great if you have insurance. Can you afford the premiums? Can you afford the copays? Is there a barrier to actually get to where you need to go to get care? And then are you comfortable when you're there? Do you feel like, this is someone who really cares about my health and well-being? And unfortunately, the percent of non-elderly adults that, the cost was a barrier. There's quite a difference in the Black and white populations in the US. And then when you look at comfort level, do they feel like they were treated unfairly or maybe discriminated against while getting that care? Okay, they did it. They did everything. They got insurance. They got to the their healthcare personnel, but then they just felt, that they were just treated poorly, and that's going to lead to people not coming back and seeking care, and that's a problem. And there's a big, even bigger disparity between Black and white people in the US and that feeling. Next slide. Diabetes in California. I don't know. Every Black person I know has a family member with diabetes. I know we have several in our family. And this bears out in California. The Black African-American, non-Hispanic Black African-American population has the highest rate of diabetes. And this can lead to a lot of different, health issues that aren't just the diabetes and affecting other aspects of their life. Next slide. Same thing for rates of cardiovascular disease. I mean, having diabetes actually increases your risk of cardiovascular disease. So this is another thing that kind of plays off of each other. And the rate in California is just so much higher for the non-Hispanic Black African-American residents of California. I mean, all the other races and ethnicities that are displayed here are pretty similar, actually. But there's just a huge difference in the Black population. Next slide. Rates of asthma. There are some, some groups that are kind of close to Black African-American residents in California, but it's still high. And it's still higher than a lot of other races and ethnicities. And I mean, California is wonderful and the weather is great, but there's a lot of wildfires. And if you live in Sonoma County, there's a lot of wildfires. And even if there isn't one here, there's one, close enough where the air quality can become quite bad. And that really can exacerbate things like asthma and any other underlying medical conditions. It can make you, at higher risk for COVID outcomes and things like that. So it does matter, and it's concerning that the rate of asthma is so high in California in the Black population. Next slide. This is really striking, and this is Sonoma County level. And Sonoma County's Black residents have a lifespan 10 years shorter than any other racial or ethnic group in the county. I mean, this is huge. I mean, that's a lot. 10 years is significant. And I don't know if we have a good reason why. This is, I think, one of those things we really should delve into a lot further. But, Black residents in Sonoma County have lower levels of well-being than Black residents of the state as a whole, and live 3 years fewer than the other state, Black African-American residents. And there's also an aspect of the physical and mental health of the population in Sonoma County. And it's difficult to make big statements or broad statements about that, again, because of the smaller numbers, but definitely something we need to be looking at and trying to figure out how to better assess. Next slide. So we'll do, because, it's like obligatory, we have to talk about COVID still. But, across the pandemic, the Latinx population has been the most affected by COVID-19, but throughout, the last 2.5 years, as, different timeframes, different races and ethnicities have had, higher case rates. And currently Pacific Islander residents are experiencing the highest case rates, but Black residents are following right up behind with 20 new cases per 100,000 per day. So quite high rates of COVID-19 cases. Next slide. So really, I think the thing to take away here is you would expect that the rate of or percent of people in a population that get an illness or hospitalized or die from something would be similar to what their percent makeup of is in the county. Now, in this slide, the Black and Black African American non-Hispanic group is about 1.3% of the population. It kind of depends on the year that this was done, but they make up 2.5% of deaths due to COVID and 2.5% of hospitalizations. So that's being disproportionately affected. There's, this would not be expected. But all of those social determinants of health and things like that have, I think, definitely played into this. And we've seen that also in other races and ethnicities. Next slide. Vaccination. For the primary series, for those first 2 shots, Black residents have had the highest proportion of fully vaccinated people. Again, the numbers are small. So if you have, a good proportion of a good number of a small number, that makes the proportion look pretty good. But that's great. I think it's something to celebrate. However, when we got to the boosters, we didn't get that same turnout, unfortunately. And only 61% of eligible Black residents that are 12 and older have received the COVID-19 vaccine shot. And it's great to get the primary series, but data keeps showing that immunity will wane, and it has already waned or gone away or diminished over time. And so that's why they keep recommending these boosters to keep people, avoid the risk of severe illness, hospitalization, and death. So this is a big deal, and we would love to see and maybe work with you on how to get more of our Black residents their booster shots for COVID. Next slide. All right, so Mpox, it's the newest, hottest thing out there. So we'll do a few slides on this. And I think, it's overall a pretty good story. We're seeing a decrease in the state of California and it's been kind of steady in Sonoma County. So we're not seeing a continued, spike in cases. But as of the 20th, we had 45 cases, majority are male. And at the time, no race or ethnic group had been disproportionately affected. So again, if we say the Latinx population is about 28.6% of the, people in Sonoma County, we're looking for them to be about 28% of the cases. And that has held, that kind of thing has held true. So that's been pretty good. Next slide. So at the California level, and I'll just say the reason we don't go into more detail on the Sonoma County level is because those numbers are considered small, 45. It's harder to make any big statements and claims with that number. And also we don't want to potentially identify anybody who was a case. We want to keep people's information as confidential as possible so that they can tell people what they want, but we don't want it to be identifiable. So we'll take a look at California and the rates of Mpox by region. I think, the Bay Area has been the highest throughout since this started, the Bay Area and LA County. And we remain the highest rate of Mpox in the state, in the Bay Area. And then when you look by race and ethnicity, it's so much higher in the Black African American population. And I think if we look at the next slide, it kind of shows this even better. So next slide. If you look, let me just kind of set the tone for this slide. So the little small vertical up and down lines, are the percent population, you know, the percent that this age range or race and ethnicity make up of the state. And if you look at the horizontal, you know, full blue lines, that's the percent they're making up of MPOX. So when you look on the left, you know, the 14 to maybe 44, 25 to like 44 age range are way over their vertical lines. They're making up more of the cases than we would expect. And then when you look on the right-hand side, for race and ethnicity, we're seeing the same for Latinx, but even more so for Black and African American. They've probably are twice as much as what we would expect as far as cases. And same thing for male and gay and lesbian, and or not lesbian, but same gender loving. So much more than we would expect. All right, next slide. And I think this is my last one. This is, you know, we mentioned the small numbers and the poor infant outcomes in the US for Black African American mothers, but just a, you know, a little snapshot. There's about 59 births per year in Sonoma County to Black African American mothers. That's about 1% of the total births. And about 46% of those births are covered by Medi-Cal. Whereas when we're looking at the county average, it's only about 37%. And, you know, the birth rate is about 7.4 in Sonoma County for Black African American residents. And over time, for all races and ethnicities, including Black African American population, the birth rate's going down. So the number of births are going down. And I think those are the main data highlights I wanted to put out there. And I'm going to hand it over to Tina to go a little further into mental health.
Okay, so I want to share, before we advance the slides, just some general information around mental health. Mental health is such a really important topic. Of course, healthcare in general, you know, and I think we don't talk about it enough. You know, studies indicate, you know, that Black Americans are less likely to seek mental health care. And some statistics have indicated that about 25% of African Americans will seek mental health treatment. And see, this is compared to about 40% of white Americans, and that's nationwide. And there's unequal access to health care. It is one of the major contributors to this type of disparity. And when we talk about what it looks like nationally, there's about nearly 10% of our African American people in the US that do not have health insurance. And this is compared to about 5.2% of non-Hispanic white people. So when we talk about members of our Black community who are not seeking mental health care, they are more likely to receive it from an emergency department rather than a mental health specialist. And this is concerning because Black people can face prejudice from healthcare providers, and there's a lot of mistrust. Dr. Baldwin was talking about, you know, the discriminatory practices or those attitudes and feelings that individuals feel when they're going in for physical health care. And it's those same practices that are felt with respect to mental health care. So it's just those shared experiences that our Black community is facing with respect to racism and discrimination and inequity that significantly affects a person's mental health. And so whether you're actually being treated or even the perception of feeling like you're less than because of the color of your skin, it's traumatizing, it's stressful, and it creates this attitude of mistrust, in particularly when it comes to mental health care. So we'll get into some of the statistics now, so you can advance the slide. So when we talk about mental health in the Black community, Black adults in the US are more likely than white adults to report persistent symptoms such as sadness or hopelessness, or feeling like everything is difficult or everything is hard. There's emotional distress, everything is just an effort. And studies indicate that only 1 in 3 who actually need mental health care are actually going to go out and get that help. And some of the barriers that we're seeing, why these things persist and why this is happening, one of the barriers is socioeconomic disparities. And these would include things such as exclusion from health. And these disparities contribute to worse mental health outcomes. Some of the other socioeconomic barriers are educational. Some of the others are economic resources, a lack thereof. Another barrier is stigma. There are a lot of negative attitudes and beliefs towards people who live with mental health conditions, and this is pervasive throughout our nation. And this can be particularly strong within our Black community. One study showed that about 63% of Black people believe that a mental health condition is a sign of personal weakness. And so as a result of this, people may feel or experience shame about having a mental illness and worry that they're going to be discriminated against because of this particular condition. And so for many in our Black communities, it can be challenging to discuss their mental health or go out and get help because of this kind of perception. And then another barrier is the provider bias and inequality to care and a lack of cultural responsiveness. And so what we found is that Black people have historically been negatively affected by prejudice and discrimination in the healthcare system nationwide. And it's extremely unfortunate because many Black people still have these negative experiences even today when they attempt to seek treatment. This provider bias is both conscious and it's unconscious. And there's a lack of cultural competency. And this type of lack results in misdiagnosis. It results in inadequate treatment. And ultimately, again, as I mentioned, it leads to that mistrust with mental health professionals, and it creates these barriers that we see of folks going and getting the treatment that they so need. And I wanted to share, I wanted to provide an example. There were some research studies. I know you've heard about the Tuskegee syphilis experiment. And this is where Black people were subjected to medical experiments, and this was without their permission. And these historical cases, such as this, created these biases and these inequalities of care, and really began that foundational mistrust that even pervades today. And then the mainstream psychotherapy has its roots in Western Europe. So some of these early treatments were white men. And so again, which contributed to a lot of that provider bias and inequality of care that still exists today. Next slide. So when we talk about mental health and incarceration, there is an overrepresentation of people of color, especially Black people, in our criminal justice system. Nationally, Black people are 3.5 times more likely than others to be incarcerated in jail, and 5 times more likely to be incarcerated in prison. And there are severe implications for mental health. There's nearly 50% of people in jail who've been diagnosed with a mental illness. And evidence suggests that people of color within our justice systems are less likely to be screened or treated or diagnosed for mental health issues. And formerly incarcerated people are nearly 10 times more likely to be homeless. And as we've noted in studies, that there is an overrepresentation of people of color in our homeless population, and a lack of housing, as we know, can significantly worsen mental health problems in our Black population. Next slide. And then the pandemic impacts on mental health, as Dr. Baldwin alluded to in several of her slides. The pandemic had an incredibly disparate impact, absolutely on our Latinx communities, but also on our Black communities throughout the nation. The Black community nationally, which comprises 13% of our total US population, represents 30% of our COVID-19 cases. And then, of course, when we look at our Latino community, it makes up 18% of our national population, and it accounts for 17% of our COVID-19 cases. So this is really overwhelming. You know, our Black and Latinx communities have significantly lower access to mental health care. Although the rates of mental illness are similar to those within the white population. We've got a long way with respect to dealing with some policies that we need to address with respect to healthcare. There's depression and anxiety. It's more common among Black and Latinx adults during the pandemic. We saw this in a number of studies. So folks were facing elevated risks of exposure and hospitalization, financial impacts, loss of loved ones, and death throughout the pandemic. Next slide. And then when we look at drug overdose deaths here in Sonoma County, here locally, among our Black residents, drug overdose deaths were 5 times higher in the year of 2020 than the average in 2017 to 2019, which was around roughly 5. They rose in the year of 2020 to almost 20 deaths. The drug overdose deaths increased by 82.5% in 2020 as compared to the prior 3-year average. And then the number of drug overdose deaths in 2021 surpassed that of the year 2020. We are seeing drug overdose deaths in those particular years, 156 versus 144, and that's overall in all of our populations. And this particular data is not final. It's still being counted. And I believe this is next slide. This will be my last slide, and we can go into some questions. And let's just take a look for a moment at suicides among our youth. The overall national suicide rates did decrease in the year of 2020. Some states reported an increase in suicides among our Black residents, particularly in our young population, our youth. Sonoma County, unfortunately, has the second highest youth suicide rate in our 9 Bay Area county, and we're just behind Solano County. And when we look at the proportion of youth in Sonoma County who have considered suicide, when we look at our Black youth, we're at 21% of youth who've considered taking their own lives, as compared to our white youth at 19%, Pacific Islander at 23%, and our multiracial youth at 25%. So something's happening here with respect to overdose. Our substance use issues here in Sonoma County are skyrocketing. So we're looking at several initiatives that we're putting out in our behavioral health division here in the Department of Health Services to combat some of these things that we're seeing. But we've got a long way to go, as I just mentioned, with respect to even looking at some of the systemic issues that exist within our policy making around healthcare. So with that, we can open it up for questions. And I don't know if there are any in the chat yet, or we can.
I'm gonna bring the slides down now, okay? I'm gonna stop
Great.